The crumbling fight against tuberculosis. A funding freeze threatens decades of progress. The global battle against tuberculosis, TB, a disease that claimed 1.25 million lives in 2023 alone, faces a potentially devastating blow. Nearly 10,000 health projects worldwide, diligently working to detect, treat, and research innovative ways to combat this ancient killer, received a shockwave at the end of February. Notification from the United States that their funding was being terminated. This abrupt action, following a review of USAid spending, casts a long shadow over years of progress and threatens to undo decades of painstaking effort. The ramifications are staggering. The U.S. historically provided between $200 million and $250 million annually in bilateral funding to developing nations for their TB programs. This substantial contribution, according to the World Health Organization, WHO, is now under severe threat. The WHO issued a stark warning. Abrupt funding cuts will cripple TB prevention and treatment efforts, reverse decades of progress, and endanger millions of lives. The statement underscores the gravity of the situation, painting a grim picture of the potential resurgence of a disease that, while treatable, remains a significant global health challenge. The Stop TB Partnership, a crucial UN-hosted network of organizations dedicated to eradicating TB, experienced the chilling effects of this funding freeze firsthand. Initially notified of funding termination, the partnership later received a reversal message. However, the uncertainty remains. Funding flows haven't been restored, leaving a lingering sense of precariousness and fear among those on the front lines of the fight against TB. The lack of immediate and consistent funding casts a pall of doubt over the long-term viability of these vital programs. The U.S. State Department's justification for the funding review centers on a new strategic approach. Every dollar we spend, every program we fund, and every policy we pursue must make America safer, stronger, and more prosperous. While this prioritization is understandable, the potential collateral damage to global health security, particularly in the context of TB, warrants serious consideration. The interconnectedness of global health challenges means that neglecting international efforts can have significant repercussions, impacting not just other nations, but potentially even the U.S. itself. The urgency of the situation is amplified by the sobering statistics. In 2023, a staggering 10.8 million new TB cases were reported globally. The disease continues to disproportionately affect vulnerable populations in low- and middle-income countries, exacerbating existing health inequalities. Furthermore, the U.S. itself has witnessed 2 significant TB outbreaks in the past 3 months, in Kansas and North Carolina. These outbreaks serve as a stark reminder that TB remains a persistent threat, even in developed nations. The fact that a nation experiencing its own outbreaks is simultaneously reducing its financial support for global TB efforts is concerning, to say the least. The WHO and UN have set an ambitious goal: the eradication of TB by 2030. However, even before this funding crisis, a massive $11 billion shortfall existed in the global TB response. The COVID-19 pandemic further complicated the situation, disrupting treatment and diagnosis, and leading to the emergence of more drug-resistant and severe forms of the disease. Doctors are now witnessing more complicated cases, including patients with extensive lung damage, highlighting the long-term consequences of interrupted care. This trend is expected to disproportionately impact the most vulnerable populations, who often lack access to consistent health care. The funding freeze threatens to exacerbate these already alarming trends. Interrupted programs mean delayed diagnoses, incomplete treatment courses, and the potential for increased drug resistance. The consequences extend beyond individual suffering. The resurgence of TB could overwhelm already strained healthcare systems, creating a public health crisis with far-reaching economic and social implications. The long-term impact on global health security cannot be overstated. The abruptness of the funding cuts is particularly concerning. Long-term projects require sustained investment to yield meaningful results. The sudden cessation of funding throws carefully planned strategies into disarray, leaving programs scrambling to maintain even basic operations. This disruption can lead to loss of trained personnel, the abandonment of crucial research, and the devastating disruption of life-saving interventions. The ripple effect of such instability could be felt for decades. The situation demands immediate action. A renewed commitment to global TB eradication, including sustained and predictable funding from international partners, is crucial. The fight against TB requires a unified global effort, and the actions of any one nation can have far-reaching consequences. The U.S., as a major player in global health, has a responsibility to reconsider its approach and ensure the continued support of critical programs combating this deadly disease. The future of millions hinges on a swift and decisive response to this funding crisis. The world cannot afford to stand idly by while a preventable disease continues to claim lives and undermine global health security. The time for decisive action is now, before irreversible damage is done.